Question 171. A patient is nearing death. What should the nurse aide focus on? A. Reassuring them that everything will be fine. B. Leaving the patient alone to pass away in peace. C. Assisting the patient through the stages of grief. D. Supporting the patient and keeping them comfortable. Answer D. Explanation. As death nears, a patient may seem to be sleeping or unconscious. They are often aware of the presence of others and are able to hear. Support the patient and speak in a kind manner. Use touch and keep them comfortable. Question 172. A resident is on a bladder training program. The nurse aide can expect the resident to A. Be on a schedule for toileting. B. Have an indwelling urinary catheter. C. When an incontinent brief is a reminder. D. Have a fluid restriction to prevent urges to urinate. Answer A. Explanation. Bladder training is a good way to treat urinary incontinence. Residents are placed on a toileting schedule that gradually increases the time between emptying their bladder and the bladder capacity. Fluids are restricted in the evening to prevent incontinence during the night. Question 173. Charting is an accurate record of all medical care while in hospital, including therapies given, treatments performed, and the patient's progress. Information typically found in the chart includes all of the following except A. Vital signs, B. Intakes and outputs, C. Assessments, D. Name of visitors. Answer D. Explanation. A medical chart is a permanent record of a patient's diagnosis, evaluations, treatments, and condition. Each healthcare team member records their treatment and the patient's response, including visitor names would be highly unusual. Question 174. The term atrophy refers to an organ or tissue becoming A. Larger because of overuse, B. Smaller because of overuse, C. Smaller because of underuse, D. Larger due to underuse. Answer C. Explanation. Atrophy occurs with underuse or disease of a part of the body, causing a loss of cells. When muscles are not used, they can waste away, resulting in poor strength or movement. In Alzheimer's disease, the brain atrophies, shrinking until all functions are lost. Question 175. A resident has an indwelling urinary catheter. While making rounds, the nurse aide notices that there is no urine in the drainage bag. The nurse aide should first A. Ask the resident to try urinating. B. Offer the resident fluid to drink. C. Obtain a new urinary drainage bag. D. Check for kinks in the tubing. Answer D. Explanation. When a client has an indwelling Foley catheter, the nurse aide should check that the tubing is open so that the urine can flow from the bladder. After each position change to when the client returns to the bed or chair after being up, ensure that the tubing is not kinked or closed. The bag should be lower than the bladder to prevent backflow. Question 176. What is the condition when patients are unable to control the bladder? A. Urinary tract infection, B. Urinary inflammation, C. Urinary incontinence, D. Urinary retention. Answer C. Explanation. Urinary incontinence is the inability to hold and control urine. Normal aging or some conditions cause the sphincter or valve that controls urination to become weak. Question 177. Objective data is any information that is fact. That means that the information is unbiased on multiple people should be able to interpret the information in the same way. All of the following are an example of objective data except A. The patient weighs 160 pounds. B. The patient has been hospitalized for 3 days. C. The patient's pain level is 3 out of 10. D. The patient's temperature is 100.3 F. Answer C. Explanation. Subjective data is based on an individual's interpretation of a situation. Pain level is a good example. Each person has a different pain threshold that cannot be accurately measured. Two people who have had the same surgery may report entirely different levels of pain on the pain scale. Subjective information is not charged, but recorded as the person states. Question 178. The normal heart rate or pulse rate for an adult human is 60 to 100 bpm. An elevated heart rate can be expected with A. An Olympic athlete, B. Increased vagal tone, C. Decreased body temperature, D. Uncontrolled bleeding. Answer D. Explanation. With severe uncontrolled bleeding, the loss of blood means that less oxygen is available for the body. As a result, the heart beats faster to try and compensate. Well-trained athletes have a normal heart rate of 40 to 60 because their hearts are strong and fit. Question 179. A common eye disorder with a cloudy condition of the lens that reduces eyesight is known as A. Myopia, B. Cataract, C. Retinitis, D. Glaucoma. Answer B. Explanation. A cataract happens when the lens of the eye becomes cloudy, causing blurry and poor vision. If untreated, blindness will result. Cataracts are the most common cause of blindness in the world. Question 180. The residence weight is obtained routinely as a way to check the residence A. Growth and development, B. Adjustment to the facility, C. Nutrition and health, D. Ability to stand and balance. Answer C. Explanation. Weight is a good indicator of a resident's nutrition and calorie intake. It should stay within a range of a few pounds. Residents who have heart failure may be weighed daily to see if they are retaining fluid. Report any sudden weight gain or loss to the nurse. Thank you for watching.